Good afternoon, and thank you for allowing me the opportunity to come and speak today. My name is Clary, and I'm a forensic nurse examiner and the program manager of the GBMC Safe and Domestic Violence Program located in Baltimore County. My job is to provide medical forensic care for patients of all ages who have been victims of sexual assault or sexual abuse. The youngest patient I have seen was under a year old. My oldest patient was 98, a Holocaust survivor. This crime does not discriminate based on age, on race, or socioeconomic status. It's tough to think about it that this could happen to any one of us here in the room, or to one of our loved ones. As a nurse, the health and well-being of my patient is always the #1 priority. We strive to provide the best, most evidence-based care that is available. But right now, we are falling short. It is not often that we have to start a patient on HIV prophylaxis, but when we do, it's essential. Unfortunately, resources are limited, and patients have difficulty obtaining this medication beyond their starter doses. I recently cared for a woman in her early 30s. It was easy to see during our interaction that she functioned on the level of a 7-year-old with a significant intellectual disability. It was over 24 hours after her assault that she made it to my emergency room. She continuously asked if it was right for her to come forward and say something. She was so afraid of getting in trouble. Her disability made her an easy target to prey upon. She was not equipped with the safety skills to assert herself when she was encountered by a stranger in her community. This stranger took advantage of her vulnerability, assaulting her numerous times before leaving her on the side of the road. She had many injuries and deep tears to her genitalia, a pathway for transmission, including HIV. The decision to start her on prophylaxis was an easy one, but the process was not. I provided her with a starter pack, and I referred her to a community health clinic. Who was going to advocate for her when she left my facility? Who was going to help her get that medication and stay on the strict regimen that is required? Who was going to make sure that she adhered to the medication follow-up? This case was very different than another case that we discussed at one of our multidisciplinary meetings that included numerous members from the community. A young male patient was assaulted. He did not have access to the HIV treatment. Only later did he learn that he had contracted the disease from his assailant. This is not fair. None of these individuals asked to be in the position that they are in. We should be doing better for these patients who have already been through so much trauma, yet are now placed in the stressful situation of needing a life-saving medication that they cannot afford. We can do better. My patients deserve better. Thank you.
Thank you for your testimony. I know it's hard. We appreciate it.
Thank you.
Who's next, please?